Its kind minimum staffing requirement for nursing homes was finalized this week at the federal level. The Biden administration's federal rule will mean big changes at the 15,000 nursing homes across the country. WENY Washington correspondent Brendan Scanlon is live with more tonight from Capitol Hill. Good evening, Brendan.
Hey there, Renata. Good evening. Well, ever since more than 160,000 nursing home residents died of COVID-19 a few years back, the issue of neglect and abuse at nursing homes has really been brought front and center. Now, this new rule is a welcome sign for those who say, look, we really have to start addressing the situation, living situation in these facilities. But the long-term care industry warns the impact of this new rule will have a dire impact on access to care. A minimum staffing rule for nursing facilities that receive Medicare and Medicaid funding will require a registered nurse to be on site in every skilled nursing facility for 24 hours a day, 7 days a week.
It's critically important to provide quality of care. That's what our families expect. That's what these facilities should provide.
The rule will require enough staff to provide every resident with at least 3.48 hours of care each day.
It basically means 3.5 hours of direct care per day per resident. That's not a lot to ask of an industry to make sure that they can provide that level of care.
Senator Bob Casey supports the rule. However, the long-term care industry has been extremely outspoken against it, saying it will fuel the access to care crisis.
This is a mandate or a rule given by bureaucrats in Washington, D.C. that is supposed to improve care all across the country. Once again, it will do exactly the opposite.
According to a study by the American Healthcare Association, nursing homes across the country would need to hire more than 100,000 additional workers to meet the requirement. The largest impact will be felt in states with a large aging population, like Pennsylvania. According to the Pennsylvania Healthcare Association, over 16,000 more caregivers, totaling about $540 million, would be needed to meet the requirements. PHCA President and CEO Zach Schamberg says it's just not practical.
If we can't find workers, then providers will be forced to essentially take beds offline and close their doors to new and prospective residents. That's why this will fuel the access to care crisis.
So, Renata, the big issue here are those major staffing shortages facing the long-term care industry and the industry not being able to hire more workers to meet these new requirements. Now, nursing home operators in urban areas will have up to 3 years to comply with the rules. Those in rural areas will have up to 5 years, and the rural area operators could also apply for a temporary hardship exemption if they do not have enough workers, again, to meet this new requirement, these new rules. Reporting live on Capitol Hill for WENY News, I'm Brendan Scanlon. Renata, back to you.